The Greens stand as co-sponsors and supporters of this bill alongside Senator Ruston and Senator Pocock. And I want to thank Senator Ruston and Pocock for the work that we continue to do together to make sure that older Australians get the care that they need at the time that they need it. I think the minister belled the cat in their contribution because they said if this bill were to pass, there would be significant cost implications around aged care assessments, which seems to me to support our view that the integrated assessment tool has been designed to reduce costs of care. Every older person in this country has a right to have a human make the decision about their care needs. And any tool that is used in that process should be simply that, a tool, not the decision maker. The Labor government has outsourced the decision-making for older people's complex care needs to a computer algorithm with no ability for human override, and that is unconscionable. And whilst the minister gets up and says that this parliament passed the rules, notwithstanding that the Greens didn't vote for them, those rules did not say that no human could override the decision of a computer tool that gets the decision wrong. When we questioned the department at estimates in our inquiry hearing and at estimates, it was clear that there has been no clinical review of this tool, that there has been no human trials of the tool. They were just tested on data from other decisions, and that the testing was internal only. Older Australians have lost trust in this government's ability to fairly assess their care needs. And the minister talks about unfairness. And yet the Community Affairs Committee, during estimates and in our inquiry hearings, has been given no evidence of unfairness, simply stating that more people in one state had higher levels of care assigned to them than another is not a demonstration that the system is unfair. How do we know that a majority of people in a particular location have particularly complex needs? If you're going to put in a tool to assess the care needs of older people, then at least back it up with evidence instead of just falling back on this idea of unfairness. Well, I'll tell you what's unfair. An older person having their complex needs put through a computer program, spat out the other end, and then told, that's it, and no human, no clinician, no doctor, no geriatrician can override that if it appears that it is wrong. When the geriatricians in this country are saying that the tool is not working, this government needs to listen. The Royal Commission said that we needed a person-centred, rights-based system. There is nothing person-centred in outsourcing the assessment of people's care needs to a computer algorithm. The government also says that they really care about older people and they're doing everything they can to give as many people as much care as possible. Well, the government is still rationing care. The Minister talked about 83,000 packages in the last financial year and 32,000 this year. Well, there's 220,000 people on the wait list. So if you really cared about older people and their care needs, you would release the same number of packages as the people on the wait list. This is about cost. This is about putting a tool in place that regularly underassesses people's care needs, forcing them into a process that requires at least a 90-day review to go back through the process again, rather than simply acknowledging that a person with clinical judgment should be allowed to override any decision that the tool makes that is unfair. Now, Labor has announced some minor changes to the IAT this morning, and that's not surprising because they have been dragged kicking and screaming at every turn that their aged care rollout isn't working. They were dragged kicking and screaming by this chamber to release 20,000 home care packages sooner when they'd stopped releasing packages. They were dragged kicking and screaming by the senators in this chamber on the Community Affairs Committee and through our work in the community and through the media to finally shift showering and dressing and incontinence care into free care, notwithstanding that people are still waiting until November. This government, this Labor government that cares so much about older people, is still making them wait until November before they have to stop paying for assistance with showering, dressing and continence care. This is a government that says that they care. So it's unsurprising that they've gone out this morning and told everybody, oh, we're changing the IAT. Well, only some people in a narrow section of exceptional circumstances are going to have the benefit of potential human override, but everybody else out there who's waiting for their aged care assessment will be still subject to the IAT without the ability of a human to make those decisions. And how can older people trust this government when the minister gets on the radio this morning and says the system is basically working fine? Well, older people will tell you it is not fine. Just this week, I had an older couple email my office telling me that they're too scared to get an assessment, even though their doctor has told them that their needs are higher than CHSP, because they are terrified that the algorithm will under-assess them and that they won't be able to afford for their care. That is the system that this government is overseeing. Trust is gone. How can older people trust you when you tell us that it's only a very small number of cases that are getting it wrong when we know it's thousands? This government clearly does not understand the consequences of their own policy, so their hand needs to be forced, which this bill does. Every older person in this country deserves to have their essential care needs assessed by a human. Basic dignity should not be reserved for exceptional cases, and that is why the Greens will be supporting this bill.
Penny Allman-Payne doesn't hold back in the Senate. The Green senator backs the cross-party bill to restore human oversight to aged care assessments, co-sponsored with Senator Ruston and Senator Pocock. She argues every older Australian deserves a human making the final call on their care needs. Any tool that is used in that process should be simply that, a tool, not the decision-maker, she says. Allman-Payne criticizes Labor for outsourcing complex care decisions to the integrated assessment tool with no ability for human override. She points out the tool was tested only on existing data internally, with no clinical review or human trials. Review requests for assessments jumped sharply after rollout, with many families reporting under-assessments that leave people without adequate support. Allman-Payne highlights the long wait lists, over 200,000 people, and says the government is still rationing care despite releasing packages. She notes Labor's minor changes announced that morning only allow overrides in narrow, exceptional cases, not across the board. She stresses the Royal Commission called for a person-centred system, and relying on an algorithm falls short. Basic dignity should not be reserved for exceptional cases, Allman-Payne says. The bill passed the Senate on July 2, 2026, putting pressure on the government to prioritise human judgment in aged care.